Wait.
I'm Janella.
And I'm Yolanda. I'm Nina's mom. How are you?
Oh,
Coordinator
your
here,
daughter.
come in.
I love your daughter.
Oh, glad to take that.
Hi,
Carla. Hi. Welcome, Janelle.
Nice to meet you.
Likewise. Okay, we'll go directly to your room, Janelle.
Okay. Thank you. It was nice to meet you.
Small closet, bathroom is right over here.
Thank you.
All right, I'll bring in a gown.
Thank you. Yes. Let's make it back your way. Thank you so much.
Here's your gown.
Thank you, Anne.
Oh,
Thank you, Ernesto. Thank you for everything.
Can you please put it on, open it to the back?
Okay.
And your underwear on for now.
Good deal.
Okay?
Okay. I'm 6.
That's it.
7.
I'll make it, yeah. I'll do it a little bit more difficult for you. You keep them up for a count of 3. That'll get the air to stay a little longer in your lungs. Yeah.
Let's try it again. Very good.
hello.
Hello, how are you?
Very good. How are you?
Excellent.
Nice to meet you. I'm Dr. Campos.
Nice to meet you. I'm Janella.
Janella. Where are you from?
Wichita, Kansas.
May I take a seat?
Absolutely.
Very good.
Thank you.
Kansas?
Kansas, land of Toto.
Kind of.
Oh, Jenella. Nice to meet you.
Nice to meet
I'm
you
fine.
too.
What about you?
I'm ready for you to give me the tool and bring me back. 2 things. That's
Hey.
it.
My name is Mario.
Hi, Mario.
Nice to meet you.
Nice to
I
meet
need
you.
to ask you a few questions.
Go right ahead.
Want to take a seat?
Sure.
Where you come from?
Wichita, Kansas.
Kansas. This place. Okay.
Say your name.
I need an interview of when I say how great you are. Thank you, ma'am. Thanks.
See you soon.
I will see you on the skinny side.
It's not lipo.
I am there, maybe.
Good morning. How are you?
Absolutely amazing. For the next day morning of my surgery, I am perfect.
Wow.
Yes, between night and day difference. The doctors have come saw me today. The nurses check on me anytime without me even calling them. They help me to go to the bathroom. I've been walking around. Today I have 2 balls on my own on my breathing machine.
Let's see.
They even hung my pictures up for my mom and my son. Okay, he said. See that?
Let's see. Good. Got 3.
I even got a 3. So do that. I feel great. A little sore as expected, but the pain, so much better.
That's your meds.
Very good meds. Very good. And they have you go into the bathroom a lot, so
Keep you walking.
yes, I have no blood clots, no nothing.
Okay.
I don't know if you want to see my sores, but you can see them. Let's see. They'll make it not x-rated here. And then
That's your drain?
This is the drain one.
Okay.
So they come in and they change it after it gets to the midline to see the fluid.
Okay.
And then there should be 8 dots. So
Okay.
there should be 5, he said.
5.
1, 2, 3, 4, and then a little guy somewhere over here. 5.
Yeah, I saw that.
So there's the 5.
Okay.
And then the shot from below, he said was for the blood thinner.
The blood there.
The blood thinner. So that looks
Good.
all good.
Doctors are happy with your progress.
unbelievable. They
Okay.
said there was no problem, no complication, nothing.
Perfect.
He
Okay.
did say that I had too long of the bowels
Mm-hmm.
and that the small intestine, the small intestine, and that no matter what, the surgery might not have been great had he not measured that and then seen what would have been appropriate to hook to the other part,
Yeah.
so that my food would not get stuck in there. All my life, he said, the reason that I had those complications is because it was always too long, and the more I
A
ate,
sleeve would not have been enough for you, you see.
right? He said it would not have been enough, that I had to have had this to have a good surgery.
Did he say how long?
Mine was 8.5, 8.9, I think he said.
Almost 9 meters.
Almost, and now it's only 3, my numbers might be up a little, 3.8. And so he said just enough now to where my food could go through, get what I need, and then be done away with. No more storing to be fat. And then that doc has a personality, Dr. Ungson, the most best personality.
Charming.
Absolutely. He told me that I have pretty teeth to be a model now, and I was on my way. And
I told him about the stripper thing.
Yes, I told him, I said I wanted to be a so I said that's what I want to be. And he was like, well, you're already there. And I was like, well, I just need the body. So, and he said that Campos said that this is the tool that I'm going to use. And then I was thinking, he's right. If you're going to eat the protein, and then you can have anything in moderation as you want, because you don't want to be in the same situation you were in.
No.
So,
Good. So this is day number 2.
yes,
Okay.
absolutely. Not even 24 hours yet.
No.
Because what we had last night is like 4.
4.
Yes.
Yeah.
And it's not even 24
It's
hours.
11. Yeah. You
Right.
look wonderful.
Thank you. I feel great.
Okay.
The guy last night, and he told me to call him Nacho. Wonderful.
The nurse.
I don't know what his real name was though, but he told me to call him Nacho.
Ignacios are
Ignacio.
called nachos.
There you go. Yes, that was him. He came in every 5 seconds. This thing had a beeping issue. He was in here, and now, I mean, smiling. He was nice. They've all been great.
Thank
Carla,
you.
all of them. What's her name? Rosa yesterday. They switched my,
Oh yeah.
'cause
Came
I
off?
said, then I said it was sore. So, no problems. They just put it over here. It was great. So I've been waiting for you my whole day. I said, where's Miss Nina? Where's Miss Nina?
Here.
So I'm glad. Oh, I'm so glad I'm here now. At first I was nervous to come along. Now I'm like, why would I bring anybody? But I did bring them in pictures. My baby, me, and my mom. And then my mom and my
Oh,
baby.
so cute.
Who's not a baby? He's 4, but I brought him.
He's a baby.
Yes.
Okay.
So,
Okay, so in your video, this is day number 2. We'll see you tomorrow.
that'll work. I'll be here.
Bye.
Bye. Everything goes great. Walking is easy. After that, the breathing is good. Because there's a good team of doctors and people here.
So this is your round to the end of the hall.
To the end and then back.
Okay. Okay, let's see.
Okay, you ready?
Let me see your new shoes.
Oh, compliments of the stay.
So cute.
Aren't they good? Almost to the end.
Ah, por acá.
Piece of cake, Ms. Nina.
Hey, good morning.
Good morning, how are you?
Fine, you? How was your night?
Excellent, it was a good night. So today is my second day after surgery. And I actually got to drink a couple little sips of water yesterday. No problem. The soreness is going better. Like it's not as sore as it was. So definitely I can tell the difference. The walking, very important. Because whenever I was getting the gas buildup, the walking helped it. I would come back and I could burp a little bit.
Perfect.
So not bad there. Then going to the restroom is much easier than it was. So a good comfortable night. Like the first day after, of course as expected, was, you know, highs and lows. But yesterday and last night, no problem.
Perfect. Good to hear that. Ready for your today's test?
I am ready for today's cocktail.
Perfect.
Good
Hi,
morning.
good morning, doctor.
How are you?
Super, how are you?
Very good. Did you have a good night?
It was an excellent night, no worries. I had a little bit to drink actually. 3 sips.
Very good. Everything's very clear. Okay.
No pain, just soreness.
How you doing with the breathing exercises?
I got 2 balls, but not for 3 seconds yet.
Let's hold it up.
I was trying.
This is the blue dye.
Okay.
It's the second leak test.
And
First one is during surgery. We use air inside the stomach and water so we can check for bubbles. This one, it will stain the stomach inside and we check that nothing comes out of the drainage. You have all morning to drink it, little sips. If you feel that you can drink it in 20 minutes, you can drink it in 20 minutes. But if you feel that you need more time, you can drink it a little bit longer. Little sips, sometimes you'll need to burp because you have air bubbles inside your stomach. So when you move the air up, the fluid goes down. So that will stain all the stomach and part of the intestine, and we check that nothing comes out of the drain, which is a negative test. For us, it's more important how do you look and how do you feel than only the leak test. You look very good. How do you feel?
I will feel very good, I'm sure.
Perfect.
As I have been feeling. So little sips.
Little sips. After the blue dye, I'm going to bring you tea apple juice and crystal light. So you will begin with oral route, and we can stop the IV, and you will continue with oral medication. Okay.
All right.
Very good. I will catch you back later.
Thank you, Doc.
Thank you.
When I was looking for weight loss surgery, I was looking on the internet trying to find one that I think I could do that would be good for me. And I contacted Nina on July 13th. And by September 19th, I was here having surgery. And it's because of her manners that she used. It was because of all the information that she gave. And it's because she treated me like a person. Anytime I emailed her, whether any time at night or any time of the day, she would always email me back. She did research for me that provided answers that I needed, that when I researched it, the answers were the same. She always, my mom called her, she always talked to us like we were a person that she knew. Then I kept looking into the doctors in the facility, and everything was coming back to where I felt like this was my home that was going to be away from my home. And it's because Nina always led us with the truth, and I felt comfortable. When I got here, she was there to meet me. Whenever I got inside the doctors, everything was like she had said. So from the beginning of when I contacted this place versus other places, it's because Nina being honest and everything all the information was going to be true, like she said, came true. So she said no matter what I needed, she would take care of me. And when I got here, the doctors did. So out of all the other places, I felt kind of not secure, but here I felt secure, especially because of before I came, Nina. Nina was always saying, this is what will happen, and then it did happen. And I talked to the people, and they said this was true. So I'm happy that I made this choice and didn't make a mistake making a choice somewhere else. Thanks. Good morning, doctor.
Good morning. How are you?
Good. How are you?
Very good.
Fabulous.
Are you ready?
I'm ready.
So step in here. Shoulders back to the table. And it will be just a second. Very good. First thing we'll see is your esophagus, and then how the stomach goes in, and then the anastomosis between the stomach and the intestine, and the rest of the intestine. Okay?
Drink still?
Think.
Yes, Doc?
Take a medium swallow.
So that's where you are.
That's where we are. Love it. We got our own Bermuda Triangle going here.
What you eating?
Apple juice
Okay.
on the rocks. With a strong apple juice.
Okay.
And then what did you have? Carne asada. He's having good stuff.
Nice.
And we're using a straw.
Perfect. Ready to go home?
I am very ready to go home. It has been a pleasure stay, but I feel great. I'm ready to see my family, and I'll be back next year.